So yesterday we talked about three remedies, F2, Ver1, and Ver2. Very, very important remedies in electrohomeopathy, Ver1 and Ver2. So basically F2, sorry, not F1. F1 already you studied in previous class. F2 works primarily on entire nervous system like F1 specifically work on peripheral nervous system, PNS. Okay, it have nine plants basically. So we use externally to apply to get the same effect of F1. So wherever the problem is the problem within the PNS, so you have to give F2 to the patient or any disease which are not related to the central nervous system, but it may be the presence of central nervous system, not related directly to the central nervous system, indirectly the effect of the disease due to the central nervous system. Okay, so you can add F2 externally there. Okay, so we use F1 internally, F2 externally. So if you want to use F2 internally, the results which is giving externally that much not there when you use internally. Basically, because the Dr. Count Caesar Matti designed this medicine, this remedy for external purpose only. So if we use internally, the result may be where varies as externally. Okay, so there's the reason we use F2 externally. And the second thing is Ver1 and Ver2. So basically these remedies are designed to work on basically on uh, large intestine or intestine basically, mostly on large intestine. Okay, and secondary, it is designed to work on worms. Okay, so there's the reason what we call anti-helminthics remedy, anti-helminthics remedy, or anti-worm remedy. So not only this, it will remove the effects like the person doesn't have worms in the body, but how he act like that he have worms. Okay, his disease act like that. So what we have to give? We have to give Ver1 internally. Okay, it will remove the effects and enhance the intestinal problems, enhance the intestinal functions basically. Okay, and the third thing you have to remember that it is act as antibiotic also because it is anti-parasitic, anti-worm. So basically it will act on bacteria also. It kills bacteria. It kills it stop the growth of bacteria in the intestine mostly. So there's the reason Vervet is given in mostly infective cases. Okay. And we have Word2. Same Word2, Word1, both functions are same, but Word2 mostly used externally. Okay. And some doctors use Word2 internally also. The effect of Word2 are both same, internally and externally. And in chronic constipation, you can use along with S-LAS, S10, C10. It will give wonderful effect. Okay, who have chronic worms, chronic intestinal issues. So you can use in this all types of problems. So wherever intestine issues are there, so you can use Ver1 or Ver2. Okay, it may be any disease. Like it may be any disease. You can use Ver1 or Ver2. So now today we will talk about important remedy that is Venerius. Okay, the important remedy is Venerius group. Okay, yeah, Venerius group. In that we have one remedy is original remedy and other uh, three, other four are compound remedy. So total when group have five remedies. One original remedy means it is the original remedy. Fourth one is compound remedy, combination of other remedies along with one when one. So let's talk about Venerio group when one. So basically when group is designed to work on two things. One is hereditary issues, the disease which are coming from family to family, member to member, person to person. Okay, and another thing is designed to uh, remove the constitutional effect which are coming from the generation. It may be same, but here constitutionally the disease is coming. Okay, according to our path, according to the modern medicine, the disease is coming due to the hereditary effect. Okay, family by family. So we are telling the disease is due to constitution. The constitution of the father, the constitution of mother. So they have disease. The same constitution affects is transformed to his baby, his child. Okay, so there's the reason this person have the disease. Okay, what we will call this, but in the modern medicine, what they call that this is due to the hereditary issues because the gene coming from the father, the gene the coming from the mother have the some effect. Okay, the gene is affected, so there is the reason the development of child later age, uh, he will get the effect of the disease or he will get the disease, whatever. So to break down that chain, so we have the group that is one when group, Venerio group. Venerio group will break down that gene, that chain, which is coming from the family to family. Okay, so I have one patient. Okay, they from past 2 to 3 generations, their mother, the grandmother, the grandmother, fourth grandmother have one issue. Okay, I don't tell you the issue because okay, so that issue is coming from 4 generation. Okay, even his father have that issue, his son have that issue. So he came to my clinic. So I advise when group along with other medication according to the condition and diagnosis. So he told that he had relief in some issues after using 1 to 2 months, 2 months medications. After you were using 2 months medication, he told that I got some relief. Okay, so I hope in future his disease will wane off. Okay, and he will be cured from that disease. Okay, so basically, when we work on the gene which is taking those effects from the father and mother, it will work that gene to break down that gene effect. Okay, basically it will work on DNA. Okay, when group work on DNA means a deeper level. So you think that I am giving the medications that it is not utilizing the it not giving the results. So at that time you have to use when group. And second thing is that in the chronic condition, when the patient comes to your clinic, mostly in the electrohomeopathy, all the patients come at chronic stage or at one stage where all the pathies are failed. Okay, at that time, he will tell you, please cure my disease. Okay, I spend lot of money in other pathies. And he will ask you, please treat the patient in less by taking less money. Okay, so we will help them because our pathy have that much. We think that that much effect to treat any type of diseases. Okay, so Venerio group will work on DNA level, hereditary level, constitutional level. and congenital level, not only hereditary, congenital. By birth defect, any birth defect, one group will help to get out from that issues. Okay. So basically, when group is designed for all these three things. So whenever a patient comes to your clinic, it may be any chronic disease, you have to add when group. Okay, so let's discuss about when one. So in when one, we have 16 plants. How many plants we have? 16 plants. Very important plants. Okay, first one, Althea officinalis. Althea officinalis. And second one is Betula alba. Betula alba. Okay. And third one is Martus communis. Martus communis. And fourth one is Eclamptus globulus. Eclamptus globulus. Populus tremuloides. And this is the fifth one from Populus tremuloides. And Rosa canina, sixth one. Rosa canina. Solinum del Camara. Okay, this is the sixth one. Seventh one. And Stephanesia elongata. Stephanesia elongata, eighth one. And Tilia europea, ninth one. Tilia europea, ninth one. Okay. Next is Veronica officinalis. Veronica officinalis. Next is Viburnum opulus. Viburnum opulus, 11th one. And 12th is Similex medica. And Vinca minor, 13. Vinca minor. Thuja occidentalis, 14. Thuja occidentalis. Clematis recta. Clematis recta. And Cannabis sativa. Okay. Cannabis sativa. So these are the 16 plants which are used in the Venerio group when one. So already told you that where does that this Venerio group work? So not only on the hereditary constitution or congenital diseases, but also whenever degenerative stages are happened. What happened? Degenerative stage. Because in the degeneration, what will happen? The cell will lose its ability, its function. Complete, not complete function, but uh, some sort of function, it will lose 50, 60%. Okay, so when one will have the ability to work on the DNA to regenerate the cell, or it may be replace that cell with new cell. Okay, so it have some capability to do this. Okay, so it will work on all types of regeneration, degeneration to regenerate it. And basically it will work deeply because DNA level work will happening in that place. So deeply it's working. So in any type of chronic diseases, you can give one group. So and like fungal diseases, skin issues, cancer, tumor, anti-inflammatory diseases, arthritis, okay, rheumatoid arthritis, okay, and all types of women diseases, mostly PCOD, okay, and other types of in female or male infertility. So in all type of diseases, you can give when one. Okay, basically, I want to tell you one thing that about modern medicine. That modern medicine will work on particular type of things. Okay, they work on receptor, they work on DNA level. They have work on every organ, different types of organs. Okay, so basically, it will act forcefully, not friendly. Allopathy medicines will act as forcefully that the cell wants to act or not. It will make that cell to act like that only. So what will happen that gradually when he do force on that cell, cell functions may be changes. Okay. Some uh some other side effects may be seen. Okay. Uh, have one patient that he have BP from past 15 to 20 years. Okay. He took anti-hypertension medications, even though his BP is not maintained. So he changed a different types of cardiologist. He met with the number of nephrologists, every type of doctor he met. Every doctor is giving the medications, and they are telling that you can your BP will maintain gradually. Your BP will maintain. So he used all the medications of different physicians for more than 20 physicians, 15 to 20 physicians. Okay, even though his BP was not normal. And whenever his BP increases, he had body pain. So he used uh, NSAID, anti-inflammatory medications, painkillers. So regularly he used those medications. So gradually, what happened? That his kidney failures happened. Okay, so I don't know. So why this his BP is not maintained and why he used all types of medications. But one thing is that by using this modern medications, you have very serious side effects. The person kidney is failure happened. So what we have to do, we have to help our body friendly. Okay, not forcefully. Okay, so when one not act forcefully, it will act friendly, and it will make the cell happy, and the cell will grow automatically. The substance which is present in the when one will help to grow the cell to do normal functions friendly, not forcefully. Okay, so this is the difference between electrohomeopathy and other pathies. So we discussed about when one. So when one, you can give in blood issues, lymph issues, every type of diseases. So I think so that in nowadays most of the persons have degenerative issues. Okay, you can add one to every patient initially. Gradually you can decrease. Okay. So along with Venman, you can use with S group, any type of, with S group, C group, L group, and even F group. Okay. So along with A group also you can use, and YE, GE is the best electricity to use along with Venman. So S group, C group, all groups will help. F group, A group, P group even. So all groups will work friendly with along with Ven group. Okay. Next we have Ven 2, Venerio, to Venerio. So we'll talk about Venerio to S2, here Ben1 and C17. So we know that this is the compound medicine, compound remedy. So basically we have S2, Ben1, C17. Volcanism, antigen, discard this remedy from the list, because already we have that. We can, if a physician want to make this remedy, he will make it and he can use it. Okay. So S2 when 1C17. So you can notice that S2 is the female remedy mostly. Okay. And work on female genital organ. Okay. And also on the glands. When one, we know hereditary effect, constitutional effect, congenital effect. Okay. C17 is, we will talk in C group, cancerous group. Here I will basically explain that it will work on bladder, mostly bladder, urinary tract. Okay, so here it will primarily work on female genital organs. Any issues of female genital organs regarding gonorrhea, okay, or cancer of uterine, okay, or urinary bladder, okay, or kidney issues, okay, or cystitis, urinary tract infections, okay, prostate. Primarily work on female. Secondary, it will work on male also, like prostate, issues of urinary tract. Okay, so this remedy mainly focus on urinary tract infections. Not every infections are there, or genital issues. Okay, primary. Secondary, it will work on glands also. Okay, so your focus is on urinary tract infections. So primary, it will give the results. Secondary, it will also help in the gland problems, all chronic problems of the glands, like cancer of the glands, tumor of the glands. Okay. And diabetes, it also helps in diabetes also. Okay. All types of chronic problems. So you can use their S2 N1 C17. So primarily female, secondary male, third glands issues, glands congenital issues of the gland, or hereditary issues of the gland. You can use S2 N1 C7. Okay. Next we have when 3. So basically when 3 is a combination of A2, C5, when 1. Okay, A2, C5, when 1. So it is the best remedy. I told you that A2 will remove the toxic substance impurities from the cells. Okay. C5, works like metabolical structures. It is designed to work on the metabolic structural issues like in the cell. Okay, then one, the hereditary effect, constitutional effect, or congenital effect of the cells will remove all those things. So base primarily it is very good remedy for all types of inflammations, chronic inflammation disease. Okay, or you can use in glandular degeneration issues. Okay, you can use in leukorrhea. Okay, tumor, lymphoma, tumor of lymph. You can use there because A2 will remove the toxicity. C5 help the for metabolism issue when one to repair the cell degeneration. Okay, okay, and venous system. Any disturbance occurs in venous system because A2 primarily work on veins. Okay, so that's the reason we can use in this all types of disease. But primarily you have to remember that A2, C5, when one. A2 to remove the impurities, C5 metabolical structural effects, what happens in the cell, and when one for the DNA level. Okay, so if any problems occur, you can use A2, C5, when one like that. You can use in ulcer also. Okay, any inflammation also. Okay, so you can use when 3. Next to have when 4. It is also combined remedy. It is also very good remedy. A2, again A2, when 1, and ver 1. Okay, A2 mostly with along with when 1 we use A2 because we have to remove the impurities which is present in the cellular level. So that's the reason we use A2 along with when 1. Again, it is very best remedy for inflammatory diseases. Inflammatory diseases or hereditary diseases, okay, or acute, subacute conditions, emergency conditions, where you can use A2 when one level. So basically, what happened that most of the diseases nowadays are coming inflammatory diseases, or what we call anti-inflammatory diseases, genotype diseases, DNA level diseases, most of the diseases. You can see that hormonal diseases here, hormonal, I think so, not work here. To improve the gland structure, cellular function, you can use Ven1. So if the hereditary, like if the mother have thyroid, mother have diabetes, so there is a chance of coming diabetes and thyroid to the baby also in coming future. So you have to break down that issues so you can take prophylactically when one means to stop or to come the disease in future. You are stopping the disease from coming the disease. Okay. So here when one were one A2. So here the combination you can use a anti-worm remedy. When one is constitutional remedy and A2 is venous remedy along with remove the impurities from the blood on the cellular level. So this is the best remedy to remove the overall effect, overall toxicity from the body. So mostly I use this A2 when one were one. Initially, you can not every for every patient according to the condition. If he have toxicity in the body to remove the toxic effect of the medicine, of the food, of the environment, of the internal environment. Everything initially you can give A2 when one were one according to the condition for minimum 1 week or 15 days according to the condition. Depend on the patient also. Okay. So next we have when 5. This is also very good remedy. When 5. When 5 have S5, C3, A3, and when 1. So you can see that everything here which are present S5 for metabolical issues. Okay. C3, here you can give the uh, urogenital structural issues, male structural issues, and for skin. Okay. S5, not only for the metabolism, it is also designed for urogenital issues and primarily metabolism, secondary urogenital issues. Territory, it will work on mucous membrane also, ligaments also, tendons also, muscles also. So here means overall effect of the body is covered in this remedy. S5C3A1 for nutritive things. Here S5 metabolism, C3 structural issues of genital or mostly genital because it belongs to structural issues of male genital issues. So metabolism of the male genital issues, which we need nutritive things along with the DNA changes, you have to use this remedy. Okay. Wherever you have urogenital issues of the male, mostly male genital issues, along with the metabolism, with structural changes, need nutritive things, along with the disease is belong to the DNA level. So you have to add this remedy. So which is the remedy? So the disease like that, we have many issues like UTI. Okay, next we have STD. Okay, sexual transmitted diseases, AIDS. Okay, where you can use this types of diseases and mostly the disease the UTI not is not getting results with other medications. Okay, so you can use S5A3, C3, and then one. Dry itching of anal region, genital region. Okay, stiffness of the muscles and joints. You can also use because S5, A3 there, A3 nutritive things, S5 for metabolism. Okay, it will also affect on RBC, WBC, and platelets because we have A3. Okay. One thing I forget to mention that E3 is a chief remedy of blood. So it will work on RBC, it will work on WBC, it will work on platelets. So I forgot to tell you that. So A3, whenever RBC issues are there, you can give A3. Whenever WBC issues are there, you can give A3. Whenever platelets, like we have on the dengue, you have platelet issues, you can use A3 at that time. And we have HB issues because HB is related to RBC. You can use A3 there also. Okay, so this is the best remedy you can use in all types of genital issues along with other diseases which I mentioned like joint issues, muscles issues, itching, mostly genital itching, sexual transmitted diseases, AIDS, UTI, which are not cured. Okay, so this type of diseases, gonorrhea, syphilis, so all these diseases can be treated with the help of this remedy. Okay. I think, and cancer of the genital issues, you can use all these things, all this remedy with as diseases. Okay. So this is all about Venn group. So we studied in detail about Venn group, where it works, what types of plants are there, with which group it will work very good, and what are the other combined remedy are there. Okay. So I understood. If any doubts, kindly ask.